We finally got some actual numbers, guys. People have been talking about the increases in healthcare for pretty much this whole year, right? 2025. I had a viewer of mine send me what his health provider sent him will be his increases in healthcare for 2026. Pretty eye-opening. Yeah, as we know, pretty much all healthcare will be going up in 2026, right? Guys, leave me comments. Have any other of my viewers, have you got the actual hard numbers like my viewer sent me of your increases for 2026? If so, leave us a comment. Let us know. So I'll get to those hard numbers in a minute here. First of all, why? Why is healthcare cost rising? Actually, for 2026, healthcare costs are projected to go up for group insurance or the insurance you can get on your job by 8.5%. Okay. For 2026, healthcare is projected to go up for individual plans by an average of 7.5%. All right. So why? Why are these costs going up? 3 reasons. Rising cost of prescription drugs. Okay, for those of you who have prescriptions, have you noticed this? Leave me a comment on this as well, that your drugs are going up prescription-wise, cost. So the second reason, this is interesting. I had not heard of this reason before. Number 2 out of the 3 reasons why healthcare costs are increasing, more hospital stays. Hadn't heard of that. So I don't know if it's right or wrong. It's got to be right, I guess. You know, I'm getting this information from all over the internet. So more hospital stays are increasing the price of health insurance. I'll dig into that for you guys. I'll dig into that, get more information on that. And the third reason why is the increased demand for behavioral services. What are behavioral services? Those are mental health, substance abuse, stuff like that. Now, I'm sure you guys have heard about that, right? It's like an epidemic now, you know, especially the substance abuse. So because they're having to treat more of that and also mental issues, costs for them go up, which means costs for us go up, right? Now there is also the big talking point of this whole year, basically, ACA, the Affordable Care Act. Supposedly, those prices may go up by 75% plus. Not just 75%, 75% plus for people on ACA, which is like me. So, yeah, it's kind of scary out there, right? Kind of scary. Hey, for those of you who see me for the first time, my name is Duane, and this is a channel for people on moderate income. If you think you might like that, think about subscribing and like the video as well. So, actual costs now. Check this out, guys. This is very interesting. Now, my viewer did not want me to give his healthcare provider's name. I totally get it. I totally get it. He also did not want me to give the state he lives in, or the actual plan out of these 5 different plans that was in the paperwork that he showed me, which plan he's on. Okay, so I'm respecting his wishes on that, and I think it's sound advice, pretty much. We don't want to totally out someone here and then have the backlash come back on us, right? Okay, so the best way we could figure this out, up at the top here, different geographic locations, all right? The best way we could figure it out by looking at the information, this area is mostly city. This area is mixed between city and number 3, rural. Okay? His information showed 5 different plans. All right? These plans were a mix of, where is my information here? Medicare Advantage, Medigap coverage, high deductible insurance, and also insurance that focused just on hospitalization. This is just to give you an idea of how much this is going to increase. These are his increases for 2026. These are actual hard numbers, okay? So let's look at this. Plan 1 here. They're actually going down by 10%, their cost in 2026. If you go to this mixed region, they're going down 5%. If you're going to a rural region, they're going up by 10%. Now, this is not ACA covered medical. This is just through the regular marketplace. This is not ACA, okay? So you see the rural here, 10%. This plan here, now again, these plans again are hospitalization, Medicare Advantage, Medigap, and a high deductible plan. There's actually 5. You know the fifth one? The fifth one I believe is just pretty much generic plan. If you go to plan 2, in the city it's going up 8%. The mix 20%. The rural 40%. Okay? You see the differences here depending on where you live, and also just so you know that this state that he lives in, they charge more than most states for medical. Not much though. This is not the highest state. There are some that are higher. This is just to give you an advantage, hard numbers of how much these, in this state, these various across all plans are increasing. Plan number 3, 18% is increasing in the city, 30 in the mixed region, 50 in rural. Now, why do you think it's different? In this case, is it actually less in the city and more in the rural? Think about it. There's less, if you are out in a rural area, there are less people there, right? There may be like in the area I live up here in the high desert, there may be less places to go as well. That could increase costs for the healthcare provider. And they can't spread it out to as many people as well as they can in the city or even in the mixed region. So the way we figured it, that's how it's based, why there are differences in the increases or in some cases decreases for 2026. Because of the amount of people in the area and also the amount of locations available in the area. Okay, let's go down here to plan 3 and plan 4. All right, 18% increase in the city, 30% in the mixed region, and 50% increases in the rural areas for 2026. Now, this is just one provider. Okay, yours could be totally different. All right. Could be totally different. This is just to give you an idea of hard numbers, how much this is going up for my viewer. Go down here, plan number 5, very similar. Well, it's actually the same as plan number 1 here. Okay, negative 10 in the city, negative 5 in mixed, going up 10 in the rural areas. I hope it just at least gives you an information of hard increases that will be happening to certain plans from a certain provider. You can pretty much expect the rest of them to kind of like fall in line somewhere around this, okay? So guys, that just tells you right there, it's not just ACA coverage that is going up. That is just regular market insurance that he got through the marketplace, okay? He is retired, all right? He is retired. He is not working anymore. So we're going to all be hit wherever you get your health coverage pretty hard in 2026. Now, are there things that can be done before then? Sure, there's always things that can be done, right? Is this administration going to do something for that? I highly doubt it. So what do? You either suck it up and pay more for your health insurance, or, and I've had some comments on this, some of my followers are not going to pay, they're not going to get health insurance because it's going to be too expensive. And especially on the ACA part of it, that's going to put a lot of people without insurance, right? Also, it may be hard for people with pre-existing conditions now to get insurance. Yeah, so you're going to have a lot of people out of health insurance. That's not good. And I'm sure some of you, my viewers, that might happen to you. Now, what I would advise, even if it's going to hurt, guys, you don't want to go without health insurance, especially the older you are. The older you are, more things can happen, right? Something that could have been a small little thing when you're 20 years old, that small little thing could turn into a big thing when you're 67. Please don't go without health insurance, okay? No, even if it hurts in the short term. Hey, for those of you on Medicaid, you're probably or Medicare, you're probably a little better off, All right. For those of you like me that haven't got to that age yet, it's going to hurt some. But guys, please don't go without medical insurance. Please get that. Okay. So there you go. And as always, from the lovely high desert, we got this.